Good afternoon, everyone. Welcome to an update on Kentucky's COVID-19 vaccine response. Thank you for joining us here today. My name is Rochelle Seeger. I'm the Community Health Research Officer at the Foundation for a Healthy Kentucky. And part of my work here at the Foundation is to host this training series that we call Health for a Change. The Foundation began Health for a Change in 2011 to support the work of health advocates, health nonprofits, local health coalitions, and health departments across Kentucky, and people just like yourselves who are working to improve health in Kentucky. This series archived is found on the Foundation for Healthy Kentucky website, healthy-ky.org under the events tab. A reminder to you that this event is being recorded today. Please, if you're interested in submitting questions to our panelists today, please use the Q&A function in the Zoom webinar. Finally, I'm happy to turn over the call to Foundation for a Healthy Kentucky President and CEO, Ben Chandler. Welcome, Ben.
Thank you, Rochelle. And I want to thank Dr. Stack for being here. Kentucky, the nation, and indeed the entire world is in the midst of an experience unlike any of us have had in our lifetimes. The COVID-19 pandemic has affected nearly every aspect of our lives. But I think there is, in fact, light at the end of the tunnel, even if it will yet be a while before we come out the other side. I'm pleased to have Dr. Stack with us. As I'm sure you all know by now, he is Kentucky's Public Health Commissioner. He's grappling with really a lot of very difficult problems that in many respects have no solution, but he's doing a very, very, very good job of finding answers and getting our people vaccinated. And I've been particularly impressed because Dr. Stack is an ER physician by training, and he had just barely taken the job when this freight train of a pandemic hit us right between the eyes. And it's really been a tough thing, I guarantee you, for anybody to get their arms around this thing. Again, something like the like of which we've never seen in our lifetimes. Dr. Stack has had to try to manage it. We also hopefully have our Transportation Secretary, Jim Gray, with us today. He's been at a press conference. We hope he'll join a little bit later. He was recently tapped by the governor to lead a task force on the COVID-19 vaccination process, providing some much needed extra hands for Commissioner Stack's team. They're still dealing with the pandemic and of course, the huge logistical vaccine distribution task at hand. And I think we'll hear about a lot of that from Dr. Stack, and I'm not going to take any more of your time. I'm just going to ask Dr. Stack to share with us some important information and some of the updates that he has, and thank him very much for his tremendous work on all of this.
Well, thank you, Ben. Thanks for having me here today. And I've been asked to talk for about 10 minutes, or I'll start out with that, and then Secretary Gray was at a press event with the governor to talk about the ice storms coming through. So he may run a few minutes late, and so I can do some questions if the group wants me to do that before I fill time. We're a year into this, and in fact, today's my 1-year anniversary. It was February 10th, 2020 that I started my first day on the job, and that feels like a whole lifetime ago. Of course, it probably does for all of us for similar reasons, if not identical. I sometimes when I do this, I start with where we came from before I go to where we're going to go, but I'll abridge that quite a bit for the purpose of this presentation. Clearly, we have a once-in-a-century pandemic. It's impacted our lives in a way unlike any other infectious disease has at this kind of scale for all of humanity. It's not just Kentucky. It's not just the United States. It's all of humanity. And so we find ourselves at a time when the entire human population is struggling with economic and medical impact from this single infection in a way none of us have lived through before. So just to put that in context, it means that the size of the problems are enormous. And it means that no individual person, and in fact, no group of people, are up to the task of getting this just right. There is no answer. There is no perfect approach. There's only, hopefully, the hope and faith that good people, well-intended people, are doing the very best they can in trying to help all of society get through this as best we can. I think that's all we can really hope for on one level. I will tell you, I've been incredibly privileged and honored to join the public health team. There are thousands of dedicated professionals across this state who work on the Commonwealth of Kentucky and Kentuckians' behalf all the time for all sorts of different things, and have swung into intense action now for a full year almost on COVID-19, in addition to all the other things that they're still doing to support public health in the state. So fast forward to where we are now in the context of all this impact, the closings of businesses, the incredible difficulty this has placed on the hospitality industry and others too, our kids in school and other sectors, but certainly it's not been evenly distributed. It's hurt a lot of industries differently than others, and some quite severely. And we find ourselves now at a point in time when we're coming out of the single biggest surge that we've seen nationwide in the whole country. The death tolls have been the largest and are still remaining large as we emerge from the last big surge. And so deaths are the last statistic to be recorded. And remember, they're not just statistics. These are people and families who have lost loved ones or their lives. And so as we emerge from this current big surge, our death toll nationwide is well over 400,000 people. COVID-19 is the third leading cause of death in the United States of America and the state of Kentucky. It's had an enormous impact. And we have great hope now, reason to be hopeful, that these vaccines offer a path to redemption, if you will, a path to get back to something that resembles the lives we formerly knew and that we miss so much and would like to get back to. The vaccines really are nothing short of a modern medical miracle. I mean, we have, as I sit here today and talk to you, we have vaccinated over 500,000 Kentuckians. That's 1 in 9 Kentuckians have already been vaccinated. They're not all finished. They've all gotten at least one dose and are in the journey towards completing that. But put that in context that it is not yet even 1 year from the time we announced our first patient with COVID. That happened on March 6th. So functionally, that's a whole month away from now. So in 11 months, we've immunized already 1 in 9 Kentuckians for a disease that did not exist in the human species until just about 14 months ago. So that is staggering. For all the disruption, if this were the 1918 influenza epidemic, we'd have no hope of doing this now. That was completely outside of the realm of science and human understanding and potential at that point. So it's very frustrating at the moment because an enormous number of people want the vaccine who can't have access to it because there's not enough to fulfill everybody's desire to have it right away. But even so, to have immunized more than 10% of the entire state of population this quickly is staggeringly fast. And it's going to continue to increase. So, there's 2 different vaccines now, the Pfizer and the Moderna. And the Pfizer, publicly, they've announced that we are hopeful they will double their production capacity in the near future. And if that's the case, then we have access to a lot more vaccine for Pfizer. Moderna has been increasing their production capacity slowly, and we've had some increases in recent weeks. And of course, the Johnson & Johnson vaccine will be reviewed later this month for approval. And if approved, we should hopefully have access to that by the beginning of March. And so if we have continuing increasing quantities of doses for Pfizer and Moderna and more vaccine in the form of a third candidate with Johnson & Johnson, which, by the way, offers some very appealing characteristics. It's a 1-dose vaccine instead of a 2. It offers exceptionally good protection from severe disease and death, which are the 2 most important indicators of the vaccine success. And it is stable at refrigeration temperature, which is very, very different from the Pfizer and Moderna, which essentially have to be shipped as ice cubes and thawed before they're used, and which perish very quickly either once you stick the needle through the vial in a Moderna bottle, it's bad within 6 hours if you don't use it all, which means every time you stick a needle in a new bottle, you have to have 10 people ready to get vaccinated within 6 hours. And of course, the Pfizer, once it's thawed, once you take it from solid to liquid form, you have to use it within 5 days or else it goes bad. So these are they're amazing scientific advances, but difficult pharmaceuticals to deal with in many ways. The Johnson & Johnson vaccine uses a more traditional technology and is more stable under conditions we're familiar with, could enable us to make it available to a lot more people in a lot of additional ways. So I am very, very optimistic that as we enter the late spring and the early summer, so I would say beginning of May and end of June, that range, that an overwhelmingly large number of people who want to be vaccinated will have had the opportunity to be vaccinated. And we're going to have to work very diligently between now and then to help those who are hesitant about the vaccines, people who have concerns about safety because this progressed so quickly, who may be hesitant for vaccines or medical interventions for other reasons. We're going to have to work real hard as a community and as a state to help folks feel comfortable with the technology, feel comfortable with the vaccine, and hopefully be open to receiving it, because these vaccines really, really offer the opportunity, if we move quickly enough and vaccinate enough people, to reduce the great danger that this disease represents. I'll give you this longer term horizon view. COVID-19 is almost certainly to be with us for many, many years to come. It is unlikely it will just disappear. But with vaccines, with better medical treatments, and with probably a sustained change in our behavior, meaning I don't think we're going to always have to wear masks in all settings. But I do think that you will find more people wearing masks more often, and that the Western cultures may start to look a little bit more like the Far Eastern cultures, where people have used masks for many years. It just has never taken on in the Western societies. I think you're going to find more Western societies who start to wear masks more often, or at least people who are vulnerable or at high risk, and perhaps even some people who are not at high risk themselves, but when they have a cough and a fever and symptoms that are like the flu or COVID, decide, you know what, if I wear that mask, it's going to protect other people. It's going to minimize the spread of disease. So I'm willing to wear a mask when I'm sick as an act of kindness to others to kind of keep them protected. So I think there's going to be some permanent alterations through public health measures for people using masks much more than in the past. But apart from that, I'm pretty confident that barring some completely unexpected left-hand turn that is not on the horizon at the moment, that by the time we get back to fall and people go into school, it'll look more like the world we used to know. So I'm cautiously optimistic about that. And ask your patience as we work really hard to get vaccine to more people. Secretary Gray will talk about that, I think. And as we ask you to please keep following the public health measures. You have to keep your 6 feet of distance or more, wear a mask, wash your hands, get tested if you have symptoms or you were exposed, stay home if you're sick, please, please, please. We've proven the measures work. There is almost the complete absence of influenza in the state of Kentucky this year. We haven't had anything like that, going back any years that in modern era that you can track, where we have entirely eliminated influenza almost, in the state of Kentucky. And that is because of these public health measures, which work so well for the flu. But you can see how much more dangerous COVID is, because despite all those measures, COVID is still spreading, even though we've eliminated the flu as a serious consideration this year. So folks, I'm very proud of what Kentuckians have done over the last year. It's not been easy. In fact, it's been downright hard at times, but I've been inspired by the acts of kindness, consideration people have shown for each other. And remember, there's far more good in the world than there is bad. And if we come together, we'll achieve a lot more together. So thank you for the privilege to serve you and to be one of you as a citizen of the state. Thanks to Secretary Gray for joining me in this journey. I'm so grateful to have the extra assistance, and Bonnie, who has been very helpful to me as a colleague in this journey with communication. So thank you, Ben, for sharing her with us. We're very grateful to have her as part of the team. And now I hand it back over to you since Secretary Gray is with us. And I can stick around for a little bit, but I think I have to go to a meeting here shortly. So thank you very much, everyone.
Commissioner, one question that we keep getting asked, and I'll just ask it so you can answer it before Secretary Gray starts, and that is, if I'm given the choice of the Johnson & Johnson vaccine when it comes out, or the Pfizer or Moderna, wouldn't I want the more effective ones? Can you address that?
I'm glad you asked that, because I don't think I think these are complex pharmaceuticals with lots of scientific evidence rapidly being produced and released. And then we hear these headlines in the regular news, which I don't think they intend to be intentionally misleading, but they certainly don't capture the true complexity here. So let me reframe that. When they talk about efficacy, they're talking about how effective are these vaccines for preventing different types of illness or disease. So commonly they'll say it is certain percentage effective in preventing moderate and severe disease. And then they lump asymptomatic and mild together. So if you think about it, there's no symptoms, mild symptoms, moderate symptoms, and severe symptoms, okay? They sort of divide it in half and say the worst half and the best half. I'm going to reframe that for you. All of these vaccines, all three of these vaccines we're talking about, Moderna, Pfizer, and Johnson & Johnson, are virtually 100% effective from keeping you from dying from COVID-19. All of these vaccines, all three of them, are essentially 90 to 100% effective, protecting you from severe disease, meaning the disease that results in being hospitalized or going into an intensive care unit. So all three of these vaccines effectively protect you from dying or suffering severe medical injury from this. Where there's a difference may be that whereas with Moderna and Pfizer, maybe you won't have any symptoms or you'll have a sniffle, but not much else. Maybe with Moderna, or maybe with the Johnson & Johnson, you may have a cough and you may feel like you have a cold, or you may feel like you have the flu, which we're all accustomed to, and you'll still recover from it, not end up in the hospital, and certainly not lose your life to it. So I don't think anyone should, based on what I know as I talk to you today, should have any hesitation taking the first available vaccine you can receive. Any one of the three of these are ones I would take where they offer to me, and all three of these I would recommend a family member or a loved one to take the first one you have access to, not to wait to be picky or choosy about which of the three you get. And all of them, even with the pace at which we've moved, the shortening of the timelines was achieved by shortening economic risk for the companies. They did a lot of things in parallel that they would never normally do because they could lose lots and lots of money if it didn't turn out well. They did not short circuit the numbers of people involved in trials in order to ensure safety or effectiveness. So I think you should feel comfortable with any of these three vaccines.
Thank you so much. I think we'll move to Secretary Gray. We know your time is valuable, Dr. Stack, and we're just grateful that you've given us that larger perspective as well as some of the specifics that we need to be aware of. Thank you for your work.
Thank you, Bonnie. I appreciate it. And thanks for having me here today.
Welcome. Secretary Gray, they will
Hello.
pull up your slideshow and you'll be ready.
Well, hello, Bonnie. You've got the slides. And you know what? Before Dr. Stack gets away, I want to say, while he is here, that it has been, I am more, let me put it this way. I am more than grateful. I'm really honored and privileged to have been able to participate in this project and to be able to participate with someone like Stephen Stack, who is such an incredibly high performing individual, and he has such a high performance team around him. And it's been our really good fortune to be able to provide whatever assistance that we can to his team and expand his bandwidth. Now, he's given me some assignments that are sometimes really tough, which include speaking to or talking to when he gets a call from from county judges, multiple ones a day. He says, Gray, you take these. And I am privileged, though, I'll say it again, that to be involved in this project. And so, Steve, thank you for everything you've done. There's no better lead in state health in the role that you have. There is none better in our country, and we are so fortunate to have you in this job. I am not one to be casual or solicitous or gratuitous. So I mean everything I'm saying there, and I just want to get the chance to say that before he's gone.
Well, thank you,
Okay.
Secretary.
Yes, sir. Okay. So Bonnie, let me put a little context to, I know you've got these slides that we worked on, and I don't know how much time you've got for me. Give me an indicator.
You've got plenty of time. We're going until 3 o'clock and it's only 2:24. So you should be able to get through your slides and also answer a few questions, sir.
Okay. All right. Great. Well, let me put a little bit of this into context. As Dr. Stack knows, just a little over 10 months ago, the first case of COVID was diagnosed in Kentucky. And in the intervening months, of course, the virus itself represented the war and the fight. And today there's another whole challenge, and that's the vaccine. We have had 7.5 weeks since the vaccine itself was released. And in that 7.5 weeks, 444,000 Kentuckians, unique individuals, have been vaccinated. I don't know if you all are, Bonnie, are you there?
I am, and I'm not sure whose phone is ringing there.
Yeah,
Hopefully
well,
it's
unfortunately, I think it's mine, and I'm trying
Okay.
to turn it off.
Okay.
Forgive me. I just came out of the governor called me at 12:30 and said, or I got a call from the governor's office at 12:30 and said, we've got a press conference at 1:30 on the weather conditions. And so y'all have to forgive me. I'm in my car doing this and I'm on a mobile device. So I may get a phone call. All right.
We're just grateful, sir. Thank you.
No, I'm grateful to have the opportunity. All right. So the vaccines were released 7 weeks ago. And today we're at 444,000. That was as of Monday, actually, 444,000. Well, we have new data, 452,532 in unique vaccinations, individuals vaccinated in the state. Now, I've been saying for the last couple of days before the weather hit us that we would hit 500,000 Kentuckians vaccinated before the end of this week. Now, let's put that in perspective. 7 weeks, arguably the first 2 required ramping up. So let's really think about this in 5 weeks. That's what's been accomplished. Now, as Dr. Stack was saying, we have the prospect looking forward. We have the prospect that Pfizer may double its production, has accelerated its goal of having 200 million vaccinations produced and distributed by June. They've accelerated that to May. So if we project forward, it's very realistic. It's very realistic to believe that we can vaccinate up to the 2 to 2.4 million Kentuckians that are today the audience or that is targeted for the vaccinations in our state. Now, of course, we've still got to get, if it's a Pfizer and Moderna, we've got to get 2 vaccinations. But that tells you that within perhaps a couple to 3 months, and this is why we're saying the end of the spring, but we could have these vaccinations in arms in Kentuckians. And that's when, as you know, Bonnie, and many on this call know, that's when we could perhaps change the dynamic changes from not having enough supply and more demand to having more supply and less demand, and the opportunity or the challenge of increasing that demand model. Okay, so what we also know is that this is all about three words. I've already used them: supply, supply, supply. It's all about those three words. We've heard a lot about West Virginia, and I'm going to come to the next slide in just a minute, Bonnie, but let's talk about where Kentucky is vis-a-vis our neighboring states. We've heard a lot about West Virginia and how well West Virginia is doing, and they have done well. West Virginia is now vaccinating about 12% of its population. Its population is 1.7 million. That means it's right around 200,000 vaccinated. And Kentucky is at 452,000. And we are at just over 10%. By the end of the week, we will be greater than 10% of our population. And how does that compare to our neighboring states? We're better as a proportion. We are better than any of our neighboring states, with the exception of West Virginia and Virginia, which is marginally ahead of us. Now, that's not to pat ourselves on the back. It's just to say, you know, we're at roughly 18th or 19th in the country in terms of vaccinations in arms as a proportion, as a percentage of our population. Okay, let's move on to the next one. Talking just a bit about the complexities of this project. It's been described as by UPS leadership as the most complex and largest distribution logistics project in world history. Now, a lot of folks will probably challenge that and say that we've had major logistics challenges, especially during war times. But when you think about that this is targeted, these vaccines are targeted to almost not every, but close to all. In order to get herd immunity, we know that we're talking 75%. So we're talking over 200 million people in the US alone. And of course, when you think of the worldwide population, then of course that's up to 7.5 billion total. So it's a complex, challenging project. And I sometimes describe it as, you know, this is unlike, I came out of the construction business, was a project manager on the Toyota plant 35 years ago. And when I think of that project, it was complex, it was challenging. We had a plan though, we had a roadmap. The plant had been built before in Japan, a very similar plant. So we had a template. Project like this has had no real templates or no real guidelines for the complexity and the size and the scope of it. So next slide, Bonnie. Now this one's got a lot of data on it, but what it leads up to is today on the left. And then if the supply levels stay the same, and we're already seeing that supply levels are changing. 2 weeks ago, we had 53,000 vaccines a week. Today, we are approaching 73,000. And with the addition of the pharmacies, that's another 13,000, which would take us up to 86,000 vaccines. What we're doing today is allocating comprehensively across the board. Now, what does that mean? It means that we have really 4 channels. The first channel is our hospitals, our regional sites, and altogether those represent 39 sites. That includes the 3 new Kroger sites recently identified and standing up. In addition to that, 61 local health departments receiving vaccines. In fact, receiving as much as 1/3 of our total vaccines. 61 plus 39. And then on top of that are the Walgreens and the Good Neighbor sites, the pharmacies that the federal government is standing up, is shipping vaccines to beginning shortly. All right. Altogether, that represents today almost 220. By my math, we're at 217 sites that are identified and ready to be stood up and supplied in the state today. And we're building on that. We're building on that. And it all goes toward the herd immunity that is illustrated in the right. And it identifies our target population as 2 to 2.4 million. And of course, this is after removing those under 16 in our population and a discount for those who are vaccine hesitant today. Okay, next slide, Bonnie. I believe I've already talked about this. We're identifying new local and regional sites week over week. The governor is announcing those on Thursdays. And that's what can be expected again this Thursday, additional sites. We have site teams that are out evaluating sites, confirming, it's a 2-page checklist actually to confirm that the sites have the capacity for the throughput that's necessary. Following the 4 guidelines that we have from the beginning for these sites. Number 1 being population density. Number 2, equity. Number 3 is the throughput capacity. And then 4th is the ability to get to drive the drive time, which is no one has to drive more than 1 county over to get a vaccine. And at this point in time, we've only got 2 counties in the state where we're working on, where we still have to hit that threshold, that minimum threshold. Okay, Bonnie. Hold on just a second, Bonnie.
I'll just step in for a second, Secretary. This was how the map looked just a couple of weeks ago when the governor announced where we were going to be with regional and local hospital sites. So the map was looking a little bit empty a couple of weeks ago. And then Rochelle, go to the next slide, please. And then when we got to this current week, this is how it looks. So a few more sites added. We added sites in Northern Kentucky, Bowling Green, and down there in Murray. And then we'll go to one more map, Rochelle. And then on last Thursday, Governor Beshear announced that every local health department would be receiving an allotment of vaccine that's equivalent to 100 doses per 1% of the population in the counties that they serve. And so even though Clinton County down there in South Central Kentucky is colored because it's part of the Lake Cumberland District Health Department, it's that light blue that is that department. We don't see, that we see that it's more than 1 county away from a pin, but it is covered in the Lake Cumberland District Health Department. And so that health department does have an allotment of vaccine to cover the population in that county. And that department will determine how best to use that vaccine to reduce the risk of death in their community first, to address those persons who are hard to reach, and also to stick with the phases. Secretary Gray, I'll turn it back over to you for this map.
Bonnie, you did such a compelling and good job with it. I was just going to say, let Bonnie continue. But what this shows is, this illustrates our health departments that have been announced. And is this one got the new sites?
Next one.
This has just got our local health departments, right? Yeah. So it's not, we don't have, is the next slide has the is populated with
There you go.
the, there we go, with the federally supplied pharmacy sites. So you can see that within a period of, literally within a period of a month, that the site has become populated with 217 individual sites or locations. Now we have in Kentucky 1,500 eligible providers today. That's the good news. The tough news and the challenging news is that if we divided our allocation, by those 1,500 sites, we would only be able to distribute roughly 50 per site. And if you think about it, that's impossibility of performance, because the Moderna comes in a minimum plate of 100, and Pfizer comes in a minimum plate of 975 or 1,000. So as many as, if you round it, of course. All right, let's go to the next slide, Bonnie. And that may be it. Nope, we're ramping up for increased supply. We've just talked about that we're still examining sites. We have this portfolio of sites that are available. Many of you on this call, I'm sure, know of sites. There are clinics that are interested, of course, and anxious for the vaccine. Doctors' offices, of course. So we are not in a shortage of having capacity for distributing the vaccine. All right, how about the next slide? Well, this slide just simply says that our distribution plan is strategic, equitable, and based on CDC guidelines. And that shows the phases, of course. And I was talking to a doctor today. I'll just say anecdotally, I was talking to a doctor today who was telling me that among his patients that he's been talking to, now admittedly this is in Lexington, where we've got UK and standing up the horse park, but he said that they have been expressing how the ease with which they've been able to get the vaccine and go through the process. All right.
Last slide.
Bonnie.
Last slide.
Last slide. Okay. This is simply telling us that we've got several vaccine information resources for Kentuckians, kycovid19.ky.gov and vaccine.ky.gov, and our call center, which is listed here. Okay, I want to say before I close on my comments, I want to thank Bonnie again. I want to thank the foundation again. I want to thank Ben Chandler for loaning us such an extraordinary resource. I've been so impressed by everyone that's assembled for this team to execute the project, the talent. And at the top of that list is Bonnie Hackbar. So Bonnie, thank you ever so much.
Secretary, it's a pleasure, and it's an honor to work on a project that is so important to the health of Kentucky. I'm grateful to do that. I know that we just got a question about whether these slides would be available, and we absolutely will make them available. And in addition, everyone on this call will receive a little toolkit that will have a little one-pager on the vaccine, a myth versus facts guide, and a little what should I bring to my vaccination checklist. So those are some tools that we're going to be sharing with all the participants, and you as messengers in your communities and among your networks. We hope that you will share those with your networks to get the word out and help spread the word that, as Dr. Stack said at the beginning, and as Secretary Gray said, that this is a complex logistical project not known to anyone in our generation and perhaps the history of the world. And we're all doing the best that we can. And there are going to be mistakes and there are going to be missteps, but it's an amazing logistical project and there is an amazing team working on it. So keep your suggestions coming, use these resources, but also please spread the word that this is a lot more complex than it looked at first glance with the vagaries of the vaccines and their cold storage requirements and things like that. We are open to questions from participants and happy to respond to those. Secretary Gray, I think that one of the things that you talked about was if we were able to distribute the vaccine at the current rate and at the increased rate over the next couple of weeks, we could get this done in just a few short months. But in fact, that's not what's going to happen because we're going to have that vaccine hesitancy wall, and it will take a bit longer than that. Would you like to comment on that?
Sure, Bonnie. I'm gonna turn my video off for just a second, just so I can put the phone down. I'm still in the car. I'm not driving, but I think you hit it well. When we look back at the history, H1N1 10 years ago, the vaccination rate for Kentuckians was 25%. Now, clearly, this epidemic and being on the front page of the newspaper, on the front page of the news every day, and on TV all the time, and the deadly threat that it represents, we're going to get more out of the gate, more in the first month and 2 months. But I think what you've described is the dynamic that we're going to experience. Today, we have more demand than supply. Tomorrow, we're going to have more supply than demand. And this is why education, and this is why education is so important. We are seeing some evidence that folks who were originally hesitant, once they see their family and friends take the vaccine with no after effects, no follow-up effects, that they're more willing to take the vaccine. So that where we had been calculating or imagining as much as 35 to 38% vaccine hesitancy, those numbers may come down. They may come down to more like a 25 to 30%, which would be better. That takes us more than, of course, to herd immunity at 75% of our population.
Okay, good. Another question is, what kinds of behaviors in terms of following the CDC guidelines do people need to continue while we work to get to the herd immunity stage? In other words, do we still have to quarantine if we've been exposed, even if we have a vaccine? Do we still have to wear our masks? Do we still have to social distance?
The answer to all of that is yes. And I try to avoid getting out of my lane in medicine and science. But Bonnie, I know that Dr. Stack has talked about this, especially in terms of our masking and social distancing, that this is going to be something, Dr. Fauci has said it, this is going to be something that's going to stay with us for a time. And my understanding is that the quarantine measures are as well. Is that what?
Yes, exactly.
Yeah, I thought so.
Yeah.
I thought so.
Yes.
Is Dr. Stack still with us?
Yeah.
No, he had to. Oh,
No,
he is?
I'm here, Bonnie.
Please go ahead.
Yeah, let me add to that. So Secretary got it right. It's one of the great joys of working with bright people. Both the Secretary and the Governor can do my job, so I don't have to. Here's the thing. Those vaccines are amazing and they keep you from dying and getting severely sick. What we don't know yet is, can you still get infected and can you still spread disease? So if you take it and say that COVID without vaccine is the plague and it's going to kill lots of people it touches, if we've transformed it into the common cold, the problem is if you've been immunized and for you it just feels like the common cold, but you can spread it to someone else who has not been immunized, and for them it could be severe disease and end them up in the hospital or losing their life. That's the problem. So until enough people have either been infected and or vaccinated, the combined two, so that there's enough immunity in society to protect the most vulnerable and to reduce the spread of disease, we're all going to have to socially distance and wear masks. And so remember when I said, I think when we get to the fall, things will look a little bit different and a lot better. By the time we get to the fall and kids are going back to school, we should have had both enough people infected and enough people immunized that hopefully we can, markedly reduce the restrictions, markedly reduce the impact on our lives. But for the next few months, it's absolutely essential everybody wear your mask, socially distance, and do the other public health measures, because if we don't, this disease will keep spreading. And the more opportunity it has to spread, the more opportunity it has to mutate. And every now and then, when things mutate tens or hundreds of thousands of times, every now and then, dumb blind luck helps the virus and it gets better. It either spreads more easily, like the variants that we label as being found in the United Kingdom, or it spreads more easily and possibly is more dangerous, like perhaps the one we found first in South Africa. So you got to do these things and bear with us for the next, 4 to 6 months at least, so that we can get things to a better place so we don't create for ourselves a more dangerous infection.
Points well taken, Commissioner Stack. Thank you. We have another question about how many people in phases 1A and 1B who are willing to take the vaccine remain to be vaccinated. Do we know that? Do we have an estimate?
These things are tough because we don't all fit in well-defined little boxes when we describe ourselves. And so there's not an easy way to define every population with precision. That being said, I think there were probably at least 200 to 250,000 people who are healthcare personnel. There are probably another 60 to 70,000 at least who were, maybe even as many as 90,000 who were nursing home or assisted living facility folks. So maybe there's 350. We think there's about 500,000 people who are over 70. So what do you got about, I'd say 800,000 to 900,000 people maybe 800,000 people in phase 1A and 1B combined. And then when you get past that, then you get probably 1.1 million or more people in phase 1C. So by the time you get through phase 1C, we're probably getting close to having half of all of Kentuckians who have been immunized. So those would be my ballpark estimates, kind of a back of the envelope sort of description.
Okay. We have a question. Are there any plans for additional regional sites near Fayette County? There's a concern that Central Kentucky right now is only served by Fayette County. I think there are more sites than that, but would you care to address that, either one of you?
I'm sorry, Bonnie, I missed the question. Steve, did you get it? If you did, pick it up. Go ahead.
So there's 2 sites right now. There's University of Kentucky and there's the horse park. So there's 2 Central Kentucky high volume locations. There's only so much vaccine, so there's only so many of those that can start out at the moment. But will there be more? Absolutely. And as we add the pharmacies, it'll get closer to you, because now you'll be able to go to pharmacies, and then eventually there'll be enough vaccine that pharmacies and hospitals and medical practice and qualified healthcare centers, there'll be a lot more places that start to come into business over the next 2 months, I would imagine. So yeah, there may be more high volume sites, but I think it's more likely in the immediate term, you're going to just see more access to more locations to start out with. In Central Kentucky specifically, there may be more high volume sites in other parts of the states that don't have any at the moment.
Okay. One question that we've received from many people who are inquiring into your office or to the call centers, Dr. Stack and Secretary Gray, has to do with people who, for whatever reason, got a shot in another state. Maybe they were in the military and they got their first shot, but then they were released. Or they were traveling for some reason, maybe to visit a sick parent or something. But in any case, they've come back to Kentucky. They need their second dose, and just wondered what the advice you would have for those people. What should they do?
So I guess I'll take that one real quick.
Yes, sir. Go ahead, Dr. Stack.
For hardship situations, and I make this very clear, hardship, not personal convenience. We are building a process, which we hope will go live tomorrow, where persons who have examples like Bonnie specifically said, maybe you live in Florida in the winter and you came back to your normal home in Kentucky so that you could have surgery, at your local hospital where you normally would go. Or you were in the military, like Bonnie said, and you were discharged and the military says, you're on your own, go find your own second dose. We've had all of these stories have come up and a few others. For circumstances outside of the control of the individual person, we're going to have a process where you can go online and upload your CDC card so that proves you got a first dose of a vaccine and a photo ID and also just some basic contact information, and tell us why you can't get a second dose, and someone will reach out to you, verify those things. And if you meet the criteria, then we'll try to help pair you up with the access at one of our regional locations to get a second dose. If, however, you drove 2.5 hours to a regional site across the state, and then you go and upload your card and say, I just don't want to drive 2.5 hours, that's not going to be honored through this process. Unfortunately, if you decided to drive 2.5 hours, you're going to have to go back to that site, because there is no process currently supported by the federal government for some way to get any significant number of extra doses for second doses. In fact, there's no process. So this is really only a hardship consideration for a very small number of people who have circumstances outside their control. But that should hopefully go live tomorrow, and it's on a request only basis, meaning we're not going to go advertise the service. We're going to make it available for those who need it and make sure vaccine sites know it exists so they can inform people who reach out for help.
So I'm hearing the key messages here is have some patience because we still have low supply. I'm hearing when you do get your vaccine scheduled, plan on getting the second one in the same location. And the third one I'm hearing is congratulations on a great job on doing something that was logistically never been done before, and keep your patience and everyone will get their turn. Dr. Stack, thank you so much. Secretary Gray, I'm going to turn it over to Ben for a couple of final words.
Thank you, Bonnie, and greatly appreciate all that you have done too. The foundation believes that the best thing that we can do now is try to assist the heroic efforts that Dr. Stack, Secretary Gray, and the governor are doing at this point in time. As it's been mentioned, this is almost an impossible situation, one we've never dealt with before, and they're dealing with essentially a lack of supply. That really is the central problem right now. Soon that problem will be overcome. We all believe that to be the case. But in the meantime, we believe that we're very lucky here in Kentucky to have people like Dr. Stack, like Secretary Gray, who are determined to try to give their time to help make us safe and help make sure that we're healthy. We appreciate you all providing this information to the audience today and all the work that you're doing. Thank you so very much.
Thank you, Congressman. Thanks, Ben. Appreciate it. Thanks for you all hosting this.
Thank you for being our guest. You all take care and be safe in this cold weather.
Take care, everyone. Bye-bye.
Thank you all.